Good patience. All right, surgery. You had surgery, you had a BBL, you had breast done, you had knee surgery, thyroid surgery, I had thyroid surgery, complications. What happens? What happens if the wound just pops open? You got to cut up. You think they done sewed you up and you are all good to go, and then boop, next thing you know, the incision is open.
911, what's your emergency?
Because when you call your doctor, they just gonna tell you to come to the ER anyway. What the ER gonna do, child? What we gonna do? What is the ER gonna do? The first thing I'm gonna say, rewind. So many times, patients come, they done had surgery, wherever, what country? I don't know, any country but America. But even the ones, really, honestly, patients, bad patients, that have had surgery, you don't know what is, just some questions, some basic questions you need to have the answers to already. Like, if something happens, doctor, and it's 9 p.m. 2 weeks later, what do I do? Or if something happens 1 week later and it's a Saturday or Sunday, what do I do? Do I go to the emergency room? Is there somebody that's on call for your group? Is there a nurse that I can contact? You should have that information. So many times you've in pain, you just woke up from surgery, anesthesia. You don't really know what to really ask at that time. You need to have these questions answered before surgery. So that way, if, God forbid, something happens, you're not like, well, I didn't know what to do, so I just came to the emergency room. All right, but anyway, the emergency room, doctors, we're always there, and we try to do what we can, but sometimes the expectations, woo child, sometimes the expectations are that we can work miracles, and we do. We actually do. There's miracles and there's magic. There's miracle and there's magic, and y'all be thinking sometimes we magicians, and no ma'am, we're not magicians. So your wound popped open. The management of that, it actually depends. However, most emergency room doctors will not do anything to reclose a surgical wound. Most emergency room doctors will evaluate, look, see if there's any drainage, see if there's any signs of infection, see if there's anything that could be life or limb threatening. That's what we think. That's how we're trained. Is this life or limb affected? Most of the time, you do not want. If that wound has already spent some time trying to heal and recover, it's starting to close and heal from the bottom up. All right. So as it's healing from the bottom up, that's a natural process. The sutures are on the top to try to keep it together, but sometimes we don't close wounds. Sometimes we leave wounds open so that way they can continue to heal. I don't really like to use the word naturally, because some people be like, naturally, that means anything could happen. Naturally, you lazy, you don't want to do nothing naturally. No, you don't want to also enclose an infection, right? So if the wound has already opened up, there could be bacteria there. If you start to close up the wound, you could be closing in an infection. So that's one of the main reasons why any kind of old wound, old cuts, old lacerations, we don't touch them. We even have our guidelines, our time. If this wound is over a certain amount of time, we don't do that. We don't touch it. We clean it up, maybe not, give you antibiotics, give you wound care instructions, and we discharge it. Now that's for new wounds. Back to your surgical wound, because you decided to have surgery and your surgeon is unavailable. If there's what we call a dehiscence or a dehisced wound, it varies. There may be some emergency room doctors saying, you can buy this, but I know you want us to look at it, and so that's fine. We can look at it. But like the strips They sell those strips you can put over. Some people come to the emergency room like, well, I didn't know what I can do. I didn't know if I could just put that strip on. Yeah, just like we would put on the strip, you could put on the strip. Okay? Some patients come to the emergency room and they think that the emergency room doctor is going to re-suture it. You had a suture come out. It happens. And you think the emergency room is going to re-stitch that. No. If there's not bleeding, if there's not hemorrhaging, ain't nobody touching that wound other than to redress it and have you follow up. Newsflash, ER newsflash. Now, always come. This is educational purposes only. I ain't your doctor. Okay, you need to check with your doctor. This is no doctor-patient relationship. You always go if you have any question, you have any concern. You always go because, as I mentioned early on, we could redress the wound. We can evaluate to see if there's any infection. We can make sure that the bleeding is controlled. Okay? So, and your pain is controlled. That's what we can do. Absolutely. Don't go in with the mindset that we gonna reclose this back. Like a lot of emergency room doctors will not re-stitch an old wound or re-stitch an old surgical room wound unless it is to control bleeding or control bleeding, because as I meant, we're going to evaluate it to make sure there's no infection. If there's an infection, then we may give you antibiotics. Okay? And then I explained to you the reason why. And it's okay when a wound is allowed to still, y'all back in the day, if you had a cut, not everybody went to the emergency room. They just allowed that thing to go ahead and heal. Now here's the thing, unfortunately, because the stitch came out, and because we're not gonna restitch it most of the time. I ain't saying 100% of the time. Everything depends. Okay. Unfortunately, it may heal with some scarring. Okay, so that is a potential complication, and that's a downside of when something like that happens. Unfortunately, that's what can happen, is that there can be more of a potential that it won't look so pretty. It might not look so pretty, because that stitch came out. So that is a downside of not having it re-sutured and re-stuck. But at least there's no infection. At least there's no bleeding. And at least you get to call your surgeon today. If you're watching this, you got some issues with surgeon, and ask them what I need to do if something happened.
911, what's your emergency?